Okay, welcome back, everybody, to another episode in the series with Dr. Kris Wusterhausen. We call it the Low P series. You've all heard of low T, low testosterone. Well, there's low peptides as well. And so we're exploring all the different applications that physicians or providers might consider if they were going to add a peptide type treatment to their practice. Dr. Kris, welcome.
Hi, good afternoon, Steve.
So, we've been having these excellent conversations, and, there's a tendency in medicine to focus on a more of a male centric conversation. And it's just how we default think often. But there's a big part of your practice where you treat women, and they have unique needs. And why don't you talk to us more about how you approach that and what you have as far as peptide application and other applications to help women feel better, stronger, faster, jump higher?
Yeah, sure. You know, um, Actually, the majority of my patients still are females, and most women are a little bit more resistant to talking about some of their issues or needs than men are. You certainly sometimes have that female that's very open, but many times it takes a few visits, unless you ask the proper questions, to really get to the point to where they're comfortable enough to really tell you some of the things they may actually have been there for from the first visit. I find that a lot of times it's just simply asking the right questions, making them feel comfortable. Like I said, trying to create a good relationship with them. After a couple visits, they feel comfortable. They'll start telling you things that maybe you didn't, you know, plan on talking about until they open up the subject. So you know, sexual dysfunction is a really big problem with females, and again, as you kind of alluded to in the beginning, it's kind of seen simply as a male-only issue when it's simply not the truth. Yes, women can, for the most part, have sex, if they choose to, but whether they truly enjoy it to the fullest is a totally different scenario, and that's where guys we don't really think about it like that. As an erection, if we can't get an erection, we can't have intercourse, and we that's horrible, and that's what we think about. But we have to realize that many women, as they age, lose sensitivity, libido, those sorts of things. And in my practice, we always start with the most low-hanging fruit, and that's hormonal deficiencies, and start there and start with a good, well-rounded hormonal age management lab panel. That's that's whichever physician, it's up to that provider what they choose to make their panel, but we like to get a general overall health assessment. Many times it's a quite simple fix. Fix their hormones, you fix the libido issues, but I still think there's probably about 40% of those females who feel better and are doing better, and as you said, they're jumping higher and running faster, but they still don't have much of a libido, and or they or maybe they do have a libido, and their sensitivity is such that reaching orgasm is just work for them nearly, and it can be very frustrating for the patient and their partner. It's a really Guys, I find, again, are much more open to talking about erectile dysfunction than women are to talking about inability to orgasm. So many times, it's how I approach it in my practice is simply at the first visit. If it's a female, I simply tell them everything that we have to offer for females, and I always start it by saying some of this may not apply to you, but maybe you have a friend that it does, and here's the services that we offer. And so I always talk about our sexual, because we do sexual dysfunction, men and women, and we just talk about some of the female sexual dysfunction options that we have to offer. So that's how the conversation starts. Sometimes on the first visit, boom, they take off, and there we go. Sometimes maybe it's the second or third visit when they finally raise their hand and are willing to talk about it. Sometimes it's a second or third visit. When I say, how's everything going? They go, great. And I go, how's the sex life? And sometimes it's that simple as just saying, how's the sex life? And,
Mhm.
you'll be surprised. Not very many people get, they don't get much pushback from that. They're okay with it. I always tell them also in the first visit that everything goes in our conversation. It all stays within that room just between the two of us. And if you actually ask me something that I've never heard of, or if you embarrass me, good job, because I think I've heard most of it. And then that usually just kind of makes them feel, more comfortable that sexual dysfunction is okay to talk about.
So normally people don't realize there are options for women. Everyone's familiar with Cialis or Viagra, and even in the jokes, it's all there. And so I don't think people are quite aware that there actually are all these other options for women to consider that they would love to know about.
Yeah, and so once we start talking about it, we start just kind of running through some of the things, and I can kind of go through it just like if it was talking to a female patient. But of course, it depends on what the issue is. If there have been sensitivity issues, and it's literally just, I used to could have an orgasm in 15 minutes, and now it's like an hour. Many times, just a PRPO shot will many times fix that. That's just where we draw their blood, spin it in a special tube, re-inject it into the G spot, into the clitoral hood, into the clitoris. Sounds horrible, really isn't that bad. I've never had a female tell me that it was a big deal. That'll last 12 to 18 months, and many women get a lot of results from that.
Wow.
You can't hurt anyone with PRP. It's impossible to hurt them with it. It's just their own blood that you're re-injecting with them. So worst case scenario, it just doesn't work. If they're having not so much clitoral issues, although this will work too, but just from having babies and age, they're just not having as much sensitivity with actual intercourse. That's where vaginal rejuvenation can be very helpful. Also, if they're having some urinary incontinence, they cough, laugh, sneeze, they jump up and down, they lose a few drops of urine. That's where in our office we use the Thermiva radio frequency vaginal rejuvenation machine. Another machine that practically has no side effects. We like safe. We like to find things that work and are safe. We like that particular device because you cannot let the intravaginal temperature get too high because simply the machine turns itself off. So even if you had a technician staring off into space, they can't hurt them because literally the machine takes care of itself, and a lot of machines are not like that. And then we get over peptides. One of my absolute favorite peptides that we use in men and women is PT141. And I may have already told this story, I forget, but I'm a big satellite radio listener, and Howard Stern actually had talked about Suzanne Summers and how she had some clips of how active her sex life was, and someone in the clip asked her, how is it possible that you're 70, your husband I think is 80, how are y'all so active? And she said PT141. And so I always thought that was really cool. But PT141, it actually was originally discovered based off of another peptide, and that's melanotan 2. So melanotan 2 is a tanning peptide. It's the one that we use literally to get a tan. They noticed, and it's sometimes if I know the patient who I put melanotan 2 on, I do it. I don't tell them this side effect, just kind of as my inside joke, is it gives you increased libido and increased erections. And so so anyway, I love giving melanotan 2 to couples and not telling them, and just a week later they're like, there's something in that melanotan 2. But anyway, they saw this with melanotan 2, and then they found the side chains of the peptide that caused that effect, and basically reproduced that, but so and amplified it. So PT141 is an offshoot of melanotan, but PT141 will not tan you. So sometimes if a guy wants a tan, or a girl, and they want a little bit of, they don't have a horrible problem, I'll use melanotan 2 to kind of kill two birds with one stone. But ultimately, PT141, that's where it was discovered. And so it works very well. It works differently than Cialis and Viagra and Levitra. Those products work through your actual circulatory system. They're dilating vessels to bring more blood flow to the penis. This one actually works through the neurologic system. And that's why I think we talked off the on the side about a patient that for whatever reason he gets no response from Cialis Viagra, but PT141 works well for him, and so that's why we have good effects with females with just boosting the libido, and so it works really well. Really, it is an injectable, but it's an insulin needle, and again, as I've said in prior podcasts, I've never had any pushback from my patients using a insulin needle. They might have pushback, but I go grab one and show them how tiny the needle is, and after that, they're fine. It does have some nausea associated with it. That's the biggest side effect. So as I tell my providers who use this product, start low and work yourself up. Don't give them, the max dose on the first visit. They may do fine, but if they get the nausea and if it's bad enough, they'll never touch it again because they're afraid they'll get nauseated. Mm-hmm. So that's my biggest tip to providers is when you use this product to, just start slow and kind of work your way up. But it has a fairly immediate effect, so most people notice within an hour or so if it's going to work. And so we really like the PT141. And then another thing that we like to use with a lot of our female patients, actually and our male patients, is Oxytocin nasal spray, which is actually a hormone that's made in the pituitary gland. Like you may have heard of with like using oxytocin with pregnancies during childbirth to stop bleeding and that sort of thing. But some people call it the love hormone. Kind of when we get in the mood, our body secretes oxytocin, and that's kind of what attracts us to our partner. But just like we talk about everything unfortunately declines with age. That's good, that is. And so, if we do a little oxytocin nasal spray, 30 minutes to an hour before, a planned rendezvous, a lot of times patients will see really good responses with that as well.
So how does the PT 141 work? Is it like once a day and then you're always good to go, or do you do that like?
Yeah, you kind of just use it as needed. It's kind of like the Viagra dosing, where you have the daily Cialis, you take it regardless. PT141, we typically have patients. You certainly could take it every day if you'd like. Most people, though, because it does have a half-life that's not going to work around the clock, is they simply dose it, an hour or so before planned relations. And that's, the reason why we offer the O shots and the P shots and the pulse waves and the Thermiva are for those patients that really want to try to get back to not having to take an injection, a pill, a nasal spray for everything to work properly. And so you have to use combinations of those things. And then you have some patients like, I don't mind popping a pill, I don't mind taking a shot, as long as it works and I'm having a good sex life. Every patient is different. Budgets are different. Every patient is just simply different. So that's why we just try to offer a plethora of different things, and sometimes the biggest dilemma is just trying to figure what fits best into their life.
So there's other things that are going on. Maybe you're not sleeping well, or you could have other things impacting that, your desire level, or would there ever be a situation where the PT141 is really kind of stymied by some factor?
Yeah, I mean, no doubt. By no means is PT141 got a success rate of 100%. And, it, I sometimes when I do these, I wish it was as easy every single time as we make it sound. And, the good news is the majority of the time it's not too difficult, but you're certainly going to get that 1 in 20 patients that is just, stress. I mean, stress is one of the biggest factors. And I like to always tell my women, and for the most part, now Lord knows I know that not every man and woman is like this, but men are just different when it comes to sex for the most part. You know, if the girlfriend or significant other says I'm ready, we're ready. Okay, you know, it's pretty much that easy for us. When women, it's much more of an emotional thing and where they're at with their life, and you know, how much attention did you pay to them, and I mean all those things make a difference. What went on with their day at work? Are they stressed? Are they not stressed? I just find that women can be much more complex when it comes to their libido. And I'll be honest with you, it sounds funny, but I talk to a lot of my patients about setting a sex schedule. You know, simply some couples as they age and hormones go down, even when they get their hormones replaced, they still like we're still not having sex, and I'm like, well, you got to kind of have sex for all the juices, pardon my pun, to get flowing again.
Mhm.
And so like I one of my best patients, that was the case. They were contemplating divorce because they had had sex in months. And I said, so I know her well, so I could say this to her, but I said, you need to go home tonight. You need to have sex. I don't let anything get in the way. You know, they didn't have kids at home or anything like that. I said, you know, and she did, and she, you know, said, hey, it went well. We enjoyed it. Great. Okay, do it again tomorrow. You know, and then after a week or two, she's like, oh my God, we're back to, you know, having sex 3 or 4 times a week, and sex life is good. And she's coming in tomorrow. I'll follow up with her. It's been a few months, but every time I see her, she's like, oh my God, our marriage has gotten so much better. Because I do believe personally, and it's just my belief, and I do tell my patients this, that intimacy is a crucial part of marriages. And when intimacy starts to leave a marriage, whether you still love each other or not, that many times that marriage can start to kind of dissolve under your feet. And so I just think it's really, really important to make time for intimacy. And sometimes it's as simple as that with women. Fix their hormones, just get back in it, you know, start getting used to it again. So, because, you know, we all get so many people, and we're just like other people. You get so busy with your personal life and kids. But, you know, kids grow up and hopefully, you know, go on and live their life. And it's back to you and the significant other again. And you got to be careful, because I think we all know many marriages that fall apart when the kids leave the nest because they don't know each other anymore because they've spent so much time raising their kids. So we want to raise the kids. We want to do that right, but we want to keep the marriages strong as well.
Yeah, that's it. Probably a lot of people don't think about how much just your health, your energy, your deterioration a little bit, or your your low peptides, your low vitamins. These things really impact how you feel, and I bet it's amazing that after a little bit of therapy like this, this desire, this interest in each other can at least improve.
Yeah, and you know, there's so many things at our fingertips today, and I think that's what, you know, makes our patients feel like there's a chance to getting back to feeling better again, is because, you know, many times I say, hey, worst case scenario, this doesn't work. We back up, we put it in reverse, we back up 3 car lengths, and we try the next thing that I think is best. And you know, I never will tell any provider that we fix every single patient the first time. We don't. But the good news is most of our patients, I would say 95%, are just so happy that you're willing to try something different. Because I always joke, the cure for it typically in the traditional doctor's office is an antidepressant. It just
Wow.
seems like that's always the cure. Here, take Lexapro. Here, take Prozac. And one of the biggest side effects of those products is decreased libido and weight gain. No woman wants either one of those. And so, you know, but because that's what it always is tabbed as, you're depressed. You know, I'm sorry, you're just depressed. And it's like, she's not depressed. She's aging, and she needs some help with her hormones, and needs some help eating better, and some help getting back into the gym and exercising again. Because, you know, the things we could get away with at 30, 38, 40, we can't get away with necessarily at 45, 48, 55, and so on. It only gets worse as we age. So we have to tighten those habits up as we get older with nutrition, exercise. I mean, I'm certainly at 48, you know, and despite using peptides and exercising and having my hormones corrected, heck, I had a discussion with my wife just last night about, you know, changing up my diet a little bit, because with COVID, we've kind of let our nutrition
Yeah.
wane a touch. You know, we've just been Not now, but when COVID mid-March to mid-April, we were just not as busy, and we let our diets get away from us. And once you do that, it is so hard to get back. So just on that topic, like some people say, what's the one thing that costs nothing to make me feel better and give me more libido and more energy? Eat right. I mean, really and truly, it is the most important thing. If you eat like crap, you will feel like crap. You may not realize it until you eat clean, but it's the truth. You eat bad foods, you feel bad. And it's as simple as that. And no one will ever convince me otherwise.
So we're talking about injections. Where are we injecting these peptides?
Well, luckily, in nowhere that's really super sensitive, if you get my point. It's just usually belly. It's just pinch a piece. That I forgot that old commercial. Can you pinch more than an inch? I think it was a cereal commercial, but basically, pinch an inch and use the insulin syringe to poke it and inject. It's quite simple. No big deal there. But speaking of one little fact that I learned yesterday that I just want to talking about nutrition, and we've talked a little bit about epigenetic testing and how we can actually now do DNA testing and actually find out our biologic age versus our chronologic age. And one of the founders of the company I use called me yesterday because I now have one of the top, I think they said top 5 patients for biologic age versus chronologic age. They actually called to tell me about it, that we had a star amongst us. And so she was very proud to hear that. But they've done a 2-month study with quite a few patients, and they did their DNA aging pre and post, so pre and 2 months later. And all they simply did was intermittent fasting and a low carbohydrate diet. And they reversed the epigenetic clock on average 1 year in 2 months by doing that. In
Wow.
2 months, they reversed the epigenetic age by 1 year. And my point of that is just simply diet. That's what I tell my patients sometimes. If you don't think I'm the right guy for you, at least take away this, that diet is extremely important for everything.
I read a little bit on intermittent fasting, and it's like your body starts to discern, hey, we need to maybe board up for the winter a little bit because we don't know when the next meal is coming. And it does this house cleaning, which is actually very healthy. And I'm curious when I was reading that, and again, the term of the cleaning up the cells, getting rid of the dormant ones or the ones that are not really doing anything. Is that a part of the process that's going on when you're fasting?
Absolutely. Couldn't be a bigger fan of intermittent fasting. I try to do it 5 days a week. I'd like to do it more, but typically on the weekends I cook breakfast for my kids, and I am a slightly weak whenever I cook breakfast. I usually
Yeah.
eat it. So Saturday
Yeah.
and Sundays I usually don't fast, but Monday through Fridays I absolutely do a 16-hour fast. And I recommend my patients even maybe once a month to even try to do a 20 to 24-hour fast if they can. Just go to one meal that day once a month. But basically what I like to try to tell patients about intermittent fasting is weight because of insulin levels. Our diet, typically the American diet, is somewhat hyperglycemic. We eat a lot of high glucose carbs, bread, rice, pasta, corn, potatoes. It's a
Hmm.
mainstay for a lot of us. There's a lot of sugar that gets dumped into our system. Insulin is what breaks down that sugar. And insulin, kind of to your metabolic rate, is kind of like kryptonite to Superman. It does not like it. And so that's what most people do. And I used to tell patients eat 6 small meals a day. And I've completely reversed that. I feel bad that I told people that for a long time because I'm that big of a believer in intermittent fasting. But when you can go on a prolonged fast, not only is your autophagy improving, so you're repairing cells better, your apoptosis is improving, you're killing off cells that need to not be there. Cell senescence is improving because your autophagy is improving and your overall cell function is improving. But also it forces your body, if it realizes with time that, okay, Steve is not going to feed me, but for 8 hours a day. Doesn't matter how hungry I make Steve. It doesn't matter what kind of impulses I send to him. He's going to fight me and he's not going to feed. And that's one thing I really talked about patients is you cannot give into those cravings. You got to fight through them, because once you fight through it for a couple of weeks, it will stop.
Mm-hmm.
But it causes your body to burn fat for your energy stores. And so that's why you see a lot of people who exercise tremendously, but they don't fast, and they are eating a moderate to high carbohydrate intake. And when you do that, their body is able to get enough sugar from their diet, and it never requires them to go into the fat and pull that fat for energy. And so when you go into intermittent fasting and your body is without nutrition for 16 hours, and especially like if you do like I do and you exercise during that fasting state, which that is a myth that you cannot, I was always told you can't exercise fasting, you won't gain muscle, you won't do this, you won't do that. That's not true. It just causes your body to use fat for your energy stores. And so my trainer here has a saying, and I agree with him, that we should be decently hungry when we eat. A little bit of hunger doesn't mean go grab a sandwich. Now, you don't have to let yourself get to where you get, as my wife does, hangry. It doesn't have to be that bad. And you know what? I'll be honest with you. There's days that I don't make 16 hours.
Yeah.
Some days we do some ridiculous cardio workout that my trainer has, and I get about 14 and a half hours in, and I'm like, I am getting way too cranky to even see patients, and I'll go drink a protein shake or something like that. So it doesn't have to be every day. It's okay. We're all human. But yeah, intermittent fasting, your immune system boosts. Really the only time that I would not do it is if a patient's on insulin. If they're an insulin using diabetic, insulin works whether you eat or not, and you would not want someone getting hypoglycemic. So a type 1 diabetic or a type 2 diabetic who's on insulin, I would not recommend intermittent fasting for. Other than the diabetics, I really can't come up with a reason why I wouldn't use intermittent fasting.
So along with these peptides and fasting, even once a week, or along with that, what are some vitamins? So obviously we need to supplement. What are some really good quality vitamins or suggestions there to have more of a cohesive plan other than just looking for a silver bullet?
Yeah, so vitamins are always a hot topic, and it's probably the one thing in my practice that I try to work on harder myself, because when I'm talking, and I'm specifically talking to other providers right now, I still struggle with selling things per se in my office, even though they do need them. And it's actually my focus for the next few months within my practice is doing a better job of, I don't want to say being a little bit more pushy, but being a little bit more demonstrative about how important supplements are to patients feeling better, because I do truly believe that. Us physicians, providers, we're naturally not salespeople, and we really struggle with that piece.
Yeah.
And so my coworkers, my assistants pretty much handle financially everything else. The only thing that really is up to me is the supplements. And I certainly tell all of my patients what I want them to take, but unfortunately, many of them will, oh, okay, well, I'll grab that down at Walmart or whatever. And so the first thing I would tell a patient or a provider is making sure that a patient is actually getting a pharmaceutical grade supplement. Supplements are not regulated by the FDA. You and I, Steve, could come up with our own supplement line and could probably have it out there in a few months. And as long as we don't make crazy claims like we can cure cancer and we don't hurt anyone, we're okay. Mm-hmm. And they actually did a study a few years back where they just pulled random supplements off the shelf, multiple different brands, and found the vast majority of them, some of them didn't even have the product in them. And most of them certainly did not have the amount that it said on the label. And even with that goes, it's kind of like a paint job. I deal with old cars. I pay a guy that strips the car down to metal and fixes all the spots and then paints it. I could pay a guy just to throw a coat of paint on top of a coat of paint. And that's many times what you're getting with these ingredients. They're not good raw ingredients, and they're just not going to work as well. But actually, so going back to your question, nearly all of my patients need vitamin D. It's one of my mainstays, and I always say if I don't even draw blood on you, I say 5,000 international units of vitamin D a day to protect your bones, help with mood, and right now, poor outcomes of COVID has been linked to low vitamin D. So it's a very, very important vitamin. Right now, I am recommending my patients keep their vitamin C levels up with taking like 1,000 milligrams twice a day. Zinc, very important right now for the immune system, 50 milligrams, 25 to 50 milligrams a day. My practice, I only carry orthomolecular and BioT supplements, and I have an orthomolecular all-around multivitamin pack that I just really like that has a little bit of everything in it that we need. There are testings. If a patient wants to have very specific testing, we can actually test like all your vitamin levels in your blood and see what you're actually deficient in. But really, supplement wise, there's so many of them. It's precision based to that patient and to what they have going on. But if I have a 50 something year old person, typically one of my alpha base packs with omega fish oil in it and vitamin D, and then if they're on hormone replacement, I recommend a supplement called DIM, which is the base compound of broccoli and Brussels sprouts. Really does a good job of protecting the prostate and breast. The male dose that I use is equivalent to 10 pounds of broccoli in their diet per month. Female dose, 5 pounds per month. Just a lot of good overall effects, but it protects their skin, protects the hair growth that women sometimes can see on their chin from testosterone. Basically how it works is it slows the conversion of testosterone to estrogen, and so it's a kind of a partial inhibitor of that aromatase pathway. So that's kind of my core 3 or 4 supplements that I use in my practice. I certainly have a lot others on my shelf that we use for specialized situations.
Just the habit of taking a handful of vitamins every day, I can do well for a while, but then there's just one day I don't want to swallow all of those at the same time. And I've
Yeah.
seen those IV offerings
Uh-huh.
where you can get an IV, and then it's
Sure.
like you come in once a month, and I'm going, well, doesn't it just the next time you go to the restroom, is it all flushed out? How does that work?
So because since we do vitamin IV infusions as well, and I'm right there with you, Steve. I wish I could sit here and tell you that I'm really great about taking my alpha pack, but I think a 30-day alpha pack usually lasts me 60 days.
Yeah.
I don't do well, but the problem is when you try to compress all the vitamins into a pill like the one a day, it's
Hmm.
a complete waste of money. My GI buddy around the corner always jokes during your colonoscopy, "Hey, there's your one a day in your colon because it hasn't dissolved." Because you simply, I always tell patients if it's not liquid or if it's not at least 5 or 6 different vitamins in a packet, you're not going to absorb it. You can't compress 100 vitamins into a pill the size of a Tylenol and swallow it, and it just doesn't work. Now, your Centrums of the world have made billions of dollars, maybe more than that, off of doing it. But my patients ask me what I think about it. I said it's a complete waste of money to take a
Hmm.
Centrum Silver or whatever. But so vitamin IV infusions are popular. Basically, by doing it IV, you are the equivalent of a battery, in my opinion. We're recharging the battery to full, and then we're waiting for the battery because think of it like a car without an alternator. We're now waiting for that battery to drain back down. Of course, we're gonna keep a lot of our vitamins from our diet. You are right. If you've ever gotten a vitamin IV infusion, your urine changes colors and smell about 30 minutes later, and you get
Hmm.
some yellow-orange urine for a couple of urinations, and
Hmm.
like, "Ooh, the vitamins worked," and they did, and there's no doubt about that. I tell my vitamin IV patients once a month is how often I tell them to come in every 4 to 6 weeks. Some come sooner, some come later, but that's about how long I think if we're just doing it for vitamin replacement. You know, it's different if it's for a hangover or an autoimmune disorder or low back pain or whatever. But if it's just, doc, I don't want to take a handful of pills, but they're still going to have to take their vitamin D. They're still going to have to take their DIM. I mean, we just can't put everything into a bag of fluids and think that's going to work for us.
Yeah.
So I probably don't actually do as many IVs as I used to, because I've kind of started with that same approach that you're asking about right now. It's like, well, it's great, but you still got to do this over here.
Yeah.
And really, when you kind of talk patients through it, it's kind of like, so I use my vitamin IV infusions more for people like Steve's going to Hawaii for 2 weeks and doesn't want to get sick on a plane and wants to do a Myers cocktail, or maybe Joe is sick and wants a Myers cocktail, or a lot of autoimmune disorders like it in those scenarios. So, I definitely like my vitamin IV infusions, don't get me wrong, but I don't use it as much anymore just for straight up vitamin replacement.
So does a peptide therapy in general, is it helping you take advantage of your nutrition better?
Oh, absolutely. Like I'll go back to one of the first ones we talked about, CJC, ipamorelin, the growth hormone secretagogue, the one that causes our pituitary gland to release more stored and growth hormone and produce more growth hormone. If you take that peptide and you lay on the couch, I don't think you're going to be very impressed by it. I think you're going to come back to me and go, I don't know that it did a whole lot, other than maybe I slept a little better. When you combined it with exercise, that's when people see the tremendous results. And when I even approach a patient about a growth hormone secretagogue, I will not even approach a patient unless they're active, trying to be healthy patients. Unless, like, I also use it for weight loss. And so I had a couple of patients last week that really wanted to get back to the gym and really wanted to try hard and do well. And I went ahead and started them on it as well. So they're going to be exercising. So, yeah, I mean, it's a circular pattern here. Everything goes together. I like to talk to patients. Probably one of the biggest things that still today for me is, and I know new providers coming in this field struggle with this, is just, where do I start with my patients?
Yeah.
We actually, I think we talked about this about our business a few months back. We actually have started downsizing what we do. I really think sometimes you get so into so many things that the patient becomes confused.
Yes.
And the provider does as well too. So I've kind of gone with the theory that we do plenty, but I'm not really interested in doing a ton more unless it's just something that's earth-shattering, because I'd rather do a handful of things really, really well than just do a little bit of everything. And I think that's what we did for a few years. I really do. And I think it slowed our practice down. And as we've been kind of dumping off some of the dead weight of what we do, our practice has gotten busier and our patients seem to be happier. And I'm no longer afraid to send somebody down the road to say, hey, go see Joe down the road. He does that procedure.
Right.
I think people appreciate it and they end up coming back to you for other things in the long run.
Seems like the perfect patient for this is someone who's done a self-evaluation and is convinced they need to do some fundamental adjustments on their perspective of taking care of themselves. And so by thinking about peptides, vitamins, some diet, and some exercise, and maybe a little bit of fasting, one could really, really flip their house, so to speak, and really reduce the age that they're feeling. Wrong?
Yeah, and especially, no, absolutely. And the one thing that we're really starting to implement now is the objective finding of the True Age DNA test. I think that's a big player. When you can, someone now that says, and I think COVID has really done this for a lot of people. They're like, you know what? I've had time to kind of soul search as I stared at the walls for a month.
Mm-hmm.
I kind of want to take care of myself a little better, especially with all this illness floating around. And hopefully we don't have another pandemic in our lifetime, but I think we're realizing that something like this can occur at any moment. Yeah. And so I think it's caused people to realize, hey, let me take better care of myself. Some of the things are so simple and they don't even cost anything. I mean, I always joke, intermittent fasting saves you money because you're not eating as much. but people truly do feel better. But now that we can affordably do these DNA testings that used to be thousands of dollars, now it's $399, and we can do these tests and actually say, hey, you're 50 years old chronologically, but you're 54 years old biologically. That'll kind of shake some people up, like,
Yeah.
uh-oh, I'm older than my age. That's not good. But then when you can do some of these things for 6 months to a year and retest, we're just really excited that down the road we'll be able to retest these people now for an affordable amount of what I feel is an affordable amount of money, and show them, like, my gosh, look what your hard work did, versus just saying my hard work knocked off 6 pounds on the scale. Okay, great. You do feel better about that. I'm not saying that
Yeah.
you don't, but when you can look at a true, uh, tried and true test and say, oh my God, I am 2 years younger, but I aged a year in that amount of time. I mean, that's a really good feeling to patients. And so you should have seen the look on my patient's face when I told her that she's one of the top five, true age patients. She was so excited, she was like, oh my God. And she was in my gym working out, and she's like, it does work. And I'm like, yeah, keep doing it. Because she said, what should I do? And I said, keep doing everything. And she's a heavy peptide user, exerciser, proper nutrition. I mean, she is probably my star
Wow.
patient. And thank goodness, not only is she my star patient, but it showed herself to be that, whenever she did her test. So, and then I just got one back right before we got on here, and I said, if this guy's age is better than his chronologic age, I'm going to be mad because he's just not in good shape, and I'm trying to shake him up. And
Yeah.
and sure enough, it correlated that he was a few years older than his biologic age. Not that I want him to be like that, but
No, but
it's just the way it had to be in order for me to get through to him. So
well, I
that'll be
think
my phone call after this.
I think the power in what you're talking about is most people don't know that there's some other gauge of measurement. Pretty much all we know is like go step on that bathroom scale that was shoved under the shoes over there and pull it out.
Right.
It's the only thing we know to measure progress
Sure.
on anything. But to think that you could have these deep labs or this chronological test, and that I think that's very persuasive and very motivating for you to go, okay, this I see what's going on other than I'm just guessing.
Or simply an advanced scale like we have that not only gives you your weight, but it gives you your body fat, your lean muscle mass, your water weight, those sorts of things. Because really and truly, gaining or losing weight means nothing to me until I know what's happening with your fat and your muscle.
Yeah.
Because I could go out and lose 6 pounds and it totally be a bad thing. If I go lose 6 pounds of if I lose 8 pounds on the scale and I actually lost 10 pounds of muscle and gain 2 pounds of fat for a net 8 pound loss, that's horrible. That's not
Mhm.
good. And that's what we see a lot of times with extreme dieting. People, go into these starvation modes where they eat, 500 calories a day or something like that. And yeah, their scale goes down, but they're just losing mainly muscle. And that's the exact opposite of what we want. So any form of advanced measurements that we can do, whether it be labs, whether it be scales, whether it be epigenomic DNA testing, these are all just things to show a patient either how good a shape they're in or maybe not so how great a shape they're in, and then help them give them the objective measurements down the road to then follow up with them and show the progress.
Yeah, excellent. Well, Dr. Kris, I think we've had a great conversation, and I'm just thinking in from the marketing perspective of those providers that are considering doing this, how would they kind of position or sell, even though sell's like a really bad word to a doctor, but you would look for a patient that's wanting to improve, maybe is open to some holistic consideration of managing their health, doing some of these tests, and then prescribing a slow little fundamental version of what you're doing and then work up from there. I think that would be a very wise way to begin to, yeah, bring this into your practice.
Yeah, I mean the biggest thing I tell every new provider is start implementing some of this stuff on yourself. You gotta do it yourself before you can sell it to anyone else. And I won't drag it out, but I was 35. I'm 48 now. I was 35 years old. I was 35% body fat. My blood pressure was high. My sugars were high. And I realized I was a family practitioner who went into rooms and tried to tell people how to live healthy, but yet I certainly didn't look healthy at 35. And so I made a decision one day that if I was going to continue in medicine, I had to at least lead the way, because I always thought about the Norman Rockwell picture of a doctor, the overweight doctor with with the red nose, with the glasses on the tip of his nose, and I said I will not become that guy, and God willing, I won't. And I noticed that once I started living a better path, and not that I don't fall off of it sometimes, I fully admit that to my patients that I fall off of it at times, but it's just about getting back up there. So providers need to first do it themselves. Practice on yourself, maybe just diet, exercise, that sort of thing. And then family members or really close patients. We all have that core of patients that we know no matter what, they're in our corner. We don't fear being sued by them, or we don't fear if we maybe don't not as confident as we normally are, like, hey, I'm trying this, blah, blah, blah. But you got those patients like, hey, man, if you've researched it, you feel comfortable with it, let's do it. We all have that circle, and that's where you start. Still today, when I implement something new, I've got my core 20 people that, call so-and-so and let's do this. And we usually offer it for either at cost or even free sometimes, and just say, hey, this doesn't cost a whole lot. I'm covering the cost. I just want you to try it for me. And then that person ends up being so happy, you're comfortable. They then tell 5 or 6 friends, and you make up whatever little losses you had, and off you go. So that's my biggest selling point to providers. And you're right, we hate the word sales, but I don't consider myself a salesman. I just have to believe in what I'm selling, because if you believe in it, I know that's kind of a cliche, but if you believe in it, you're not really selling. You're just offering things to people.
Yeah.
And so,
all right. Well, Dr. Kris has been excellent in this conversation about peptides, the low P series. And folks that want to reach out and talk more with you, how can they contact you, please?
yeah, so website, www.theresurgeclinic.com, or my email is drkris at theresurgeclinic.com, and that's Kris with a K, so DRKRIS at theresurgeclinic.com.
All right. Well, that's excellent conversation. Thank you, Dr. Kris.
Thanks, Steve.